Hi, my name is Tasha and I'm going to be demonstrating the central line dressing change video today. I do have on all of my appropriate attire, my Nightingale scrub, I don't have any nails, nothing, my hair's back, and I have my badge. So what we want to start doing is we want to start by verifying our physician's orders, which I've already done in the computer. I will then gather my supplies, which I have here. I will be entering my patient's room. I'm going to close the door behind me for privacy of the patient, or the curtain if there is one, and I'll be performing hand hygiene once I enter the room. At this time, I'm going to introduce myself to the patient. Hi, my name is Tasha. I'm going to be your nurse today. Can you tell me your first and last name? Okay, and your date of birth. All right, perfect. So the patient has verified the two identifiers. All right, Mrs. Smith, I am going to let you know that we're going to be doing your sterile dressing change today for your central line. Is that okay? Okay, so she gave me her consent. So the first thing that we are going to want to do is we're going to want to place a mask on ourselves. Then we're going to ask our patient to put a mask on, or if they can't do it, we can do it for them. And if they can't, then of course they can turn their head away from the procedure site. As well, if we have anyone else in the room or in the vicinity of our procedure, they need to be wearing a mask just so they can maintain sterility or sepsis for the central line. All right, we're going to put your mask on. All right, so now that I have the mask on, I'm going to perform hand hygiene. All right, I am going to place on my gloves. And at this time, I am going to look around the insertion area. I want to palpate the site just to make sure that there isn't any tenderness, as well any signs of maybe some fluid or any sub-Q fluid around it. So we're just doing some palpating here and some looking around. I'm going to want to pull the dressing at this time. It's going to be with my non-dominant hand so that I can make sure that I hold stabilize the line with my other hand. So we want to make sure as well that we pull up on each corner so that we're not tearing too hard. And we want to pull away from the insertion site, and this is so that we don't pull out our catheter. That has been removed, and we are going to discard our old dressing now into the garbage. Next, we're going to inspect the site. We want to look for any redness, any drainage. We want to look for any swelling, discharge, or just any kind of signs that the site might be infected. All right, so once we are inspecting around the skin again, we just want to double check there is no rashes either, any swelling, or anything that could have developed since having the central line put in. All right. We also want to look at our catheter and make sure that there is no kinks inside of it, or that it is not dislodged. All right. So now that that has been done and we've looked everything over, we are going to want to remove our dirty gloves. We're going to want to perform hand hygiene. Okay. Now we're going to pull out our new catheter kit here. I'm going to pull out the sterile gloves. Move that out of the way. You want to only touch on the 1-inch border to open them up. You want to start by putting gloves on your non-dominant hand first. And then you're going to want to do the dominant hand. Okay. Next, we are going to take our gauze and our chlorhexidine out of our kit. And since we are using chlorhexidine, we want to make sure that it's cracked. And we want to give it a second for the solution to fully saturate the sponge. Okay, and also because when you use chlorhexidine, you want to use friction in a back and forth motion as well. So you need to be able to do that for at least 30 seconds. Okay. If we were to use alcohol, we'd want to do that in a circular motion from the inside out. But since we're not, we're going to be doing it in a kind of square motion for 30 seconds with our chlorhexidine. All right. So I'm going to grab my catheter this time and I'm going to clean. In the same kind of area that we would have our tape. 1, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. I'm also going to clean the catheter itself. All right. And then we're going to, and it is from top to bottom, and then we're going to lay that back down and allow it to dry completely. You don't want to do any fanning or any blowing. Okay, so we're going to throw everything away here. From there, we are going to grab our new dressing. And we're going to want to place it over our insertion site. We want to make sure that there is no wrinkles. You don't want to have any bubbles in that. Just as best as we can. Then we're going to want to remove the border. And we're going to want to get our pen and we're going to put today's date and our initials. We're going to place it right on the outside so that the next person who's going to see their dressing will see when it has been done. All right. And then from here, now we are going to be discarding our gloves. We're going to get rid of those. We're going to want to remove my mask. We want to remove our patient's mask. We want to make sure that our patient is comfortable. We want to make sure that the bed is low, locked, and the call light within their reach. We're going to also perform our hand hygiene, and we're going to document our procedure.